to train the levator scapula muscle. The levator scapula attaches from the superior angle of the scapula and originates from the transverse process of the C1 onto the C4. Okay. It extends the neck, it ipsilaterally rotates the neck, and it anteriorly tilts the scapula and elevates the scapula. So to train it, what I usually do is that I anteriorly rotate the scapula gently. Okay, so from the side, gently pull the scapula forward, not all the way over here because that will be the pec minor. So gently anteriorly rotate, and I pull the scapula towards the atlas, okay, towards the ear, if you will. Now, this muscle is very often inhibited and injured in people who have whiplash injury, for example, atlas dysfunction and so on, because it controls rotation of the atlas. And you can also use it to restrict certain motions. For example, if the atlas has rotated towards the left, you can train the right levator scapula to pull that TVP backwards, for example. It is important when you train it that the scapula remains slightly anteriorly rotated. A common issue I see, especially with patients who have neck injuries, is that once they start to move upwards, the scapula is moving into posterior tilt. Okay, and posterior tilting is what the trapezius muscle is doing. So if a gentle anterior rotation is not maintained, most likely you're not maintaining contact with the levator scapula. So once again, gentle anterior rotation, pull gently towards the atlas. And you can also palpate the tendon, which is right next to the transverse process, and feel if it's contracting as you pull the arm up. And in this case, of course, because I'm instructing it, it does contract, okay? So I hope this has been informative. It's an important exercise. I usually recommend doing it on both sides, because if you are using one side more than the other, you can reasonably expect that the atlas can start to shift to one side, okay? Start to rotate. And of course, we do not want that unless we are specifically aiming for that. But that's not what we are talking about today. We are talking about rehabbing and training the levator scapula. So thus I recommend doing it on both sides. And of course, it's also beneficial to train the trapezius muscle as well, because these muscles balance each other out. And the trapezius is often weak, and if both the trapezius and the levator scapula is weak, you're going to have neck pain, okay? It's almost inevitable. So that's a little information on that. I hope it was informative once again, and I wish you a nice day.